baseball, adaptive baseball. Try and keep it as close to a real baseball game as possible. They get to play 2 innings. We do the ketchup, hot dog, and mustard race in the middle. We do the national anthem at the beginning and the take me out to the ball game and hand clapping. So they're really getting the full concept of a whole baseball game, and it's totally adapted to whatever they want.
This is some of the best stuff on earth. Just seeing all these kids playing and everyone cheering for each other and knowing that they don't have to know all of the rules and they can just kind of play and enjoy themselves, and everybody's a champion here, right?
Right.
Yeah.
This means a lot for these kids that have special needs to play these kind of sports that the regular kids do and be involved in that.
Thank you so much for creating a place for people to participate in all sorts of activities, people of all abilities to come and to enjoy themselves. And there's nothing like this at other places. So this is really needed and we appreciate it.
There's a lot of people in the community who don't have access, who don't have coverage. We have the capacity of offering free services because of the funding from Olathe Health.
So the primary purpose of the Mobile Integrated Healthcare Unit is to meet people where they are. A lot of times people call 911 and we're their last resort for help. So without this program, there'd be a lot of people in this community that wouldn't have the health care that they have today.
I moved to Paola in 1993, and about that time was when they had decided to get out of the hospital business in the county and were seeking a partner, and that's when they found Olathe Med. I think Mr. Devocelle and his team worked really well with our county commissioners and came up with a plan. We look at you all as our partner in our healthcare needs, and it's not just in Paola, but you touch so many different areas in the communities from Paola, Lewisburg, Spring Hill.
There is a strong connection between health and education. So in order for students to be ready to learn, students need to be healthy.
Student Health Emergency Fund is an arrangement between Olathe Med Center and the Olathe Public School nurses. All the school nurses throughout the district can refer sick children who don't have the ability to pay to Olathe Urgent Care and receive medical care. And so there's no cost to the family. And I really think the fund has certainly saved lives in the past, that people would have stayed home and not sought medical care treatment due to cost and waited too late. I think it's certainly reduced emergency room visits and drastically reduced suffering.
On behalf of everyone in Olathe Public Schools, especially on behalf of the Olathe School nurses, my predecessors, Leah Lang, the late Peggy Barron, the current Director of Health Services, Sharon Morris, and myself, we thank you for all that you have done to support the students in our district over the years. We wish you great enjoyment and many years of good health in your retirement.